An arthroscopic rotator cuff repair is a procedure used to treat rotator cuff tears, including acute traumatic rotator cuff tears, severe partial thickness tears, and degenerative tears that don't respond to non-operative management. This procedure is usually carried out as a day case, with the patient awake under regional anesthesia, and is a keyhole operation. During the procedure, sutures are passed through the tendon is pulled down to the bone, and the sutures are fed into a plastic anchor which is buried into the bone, securing the repair. Following the operation, there is a period of recovery with up to 6 weeks in a sling, 6 months of physiotherapy during which there should be no heavy lifting or contact sport. In some cases of massive rotator cuff tears, an open repair may be needed. In chronic cases where there is muscle atrophy or fatty degeneration of the muscle belly, a rotator cuff repair may not be possible.